So anyway, Teresa asked if I could sit in and do a quick little lunch and learn on aquatic therapy and what it entails and why we do it. But if you happen to be in the South Florida area, we use the water as a medium, as a tool for therapy, but almost everybody in South Florida has bodies of water around them, and having more knowledge and more information about water and water safety and how to protect your kids is of primary importance. So I'm just going to talk a little bit about that before I talk about therapy. We have a lot of open bodies of water in South Florida, canals, even little drainage, catchment areas when there's excessive rain like we've had this week. And children are fascinated with water. So my first and foremost thing is a child's safety is the most important. So fencing, making sure any hot tub, pool, bathtub, you have eyes on your children at all times, or there's fences and doors that you can shut to make sure that they don't get into it without your knowledge. I had the experience when my children were small. We had guests at our house, and we had a hot tub with wrought iron rails that were approximately 5 inches apart. We had just recently bought the house, and I was large with a second baby in my stomach, and one of the toddlers kind of went right through that rail and into the water. I don't know how I got over that fence as fast as I did to drag him out by the seat of his pants, but I did. So that's when we got a closed cover for our hot tub. So always maintain that high level of safety with your children. Children with autism also are even a little more challenging to maintain safety. They are even more fascinated sometimes with water, less predictable sometimes with behaviors and activities. Some children tend to just slip out of your hands in a second. So keep that in mind. And in light of that, we have in Palm Beach County, the Drowning Prevention Coalition, and they do offer free swim lessons to any child. The lessons come in groups of 6, and you just go on the palmbeachgov.com/DPC, Drowning Prevention Coalition website, and you will see the applications. You'll see who offers the swim lessons, and you can sign any child up for that. Okay, there are regular swim classes, and then there's classes that do work with children with special needs. So I do encourage you to look for those. Also in our area, we have the Parks and Recreation. They have the Therapeutic Rec Center in Lake Worth, and they do some swimming and adaptive sports at that site. So, all right, I think I'm going to get started. And again, thank you for joining me. Today, I'm not going to talk about swim lessons. Swimming lessons are probably the next step beyond therapy. So when we bring children in the water, and this summer we're excited to be offering not only physical therapy, but also occupational therapy and speech therapy in the water. And that a lot of people will say, well, why are you doing speech therapy in the water? Why are you doing occupational therapy in the water? And again, we use the water as a tool. It is a modality. There's so many benefits to it. There's so many things that it can do for you. And it's a whole body experience. So from head to toe, once you're in a pool, you are working. And just being in the water itself puts a higher demand on your respiration and your heart. So you will get a workout just by hanging out in the water. Doesn't that sound good? Let's get the floats out and go get a workout. So I'm going to try and screen share here and show you a couple of different things. And Miss Teresa is very good at helping, so thank goodness she's here. Yep. All right. Go to the aquatic therapy. Okay. So I'm going to show you just a couple of things. Let's go to the benefits page, and I think that's it. I'm just going to talk a little bit about, do we have to open it, or you can just see it? This is good. There we go. Okay, she's pulling it up. So when we talk about therapy in the water, I'm just going to explain a little bit of why we use the water. So the water itself, when we talk about range of motion, that's a very physical need for some children. Some children have tight muscles. So when they get in the water, and especially a warm body of water, cold water tends to tighten muscles, but warm water, like, you know, a bathtub, when you have a strain or muscle ache, you get in that warm water and it really helps you to relax. So you'll see definite improvement in range of motion. If you have pain, if you have somebody who's had a surgery or has scar tissue, the benefit of being in the warm water, it helps to decrease that pain. And it is because it's like a full body massage. The water touches every part of your skin that's in it, and it's a gentle, comforting feeling. So related to decreasing pain is also regulating your sensory system. So I put decreased sensory defensiveness on this very old document, but we talk a lot about, you know, some children are low arousal, some children are high arousal, and we can use the water to help regulate that and bring them to a nice middle ground for their ability to pay attention and tolerate different sensory activities. Certainly being in the water, anything you do in the water that you do actively will require strength and endurance, and we can use the properties of the water to make it even more strengthening. And then balance and walking. The water buoys you up. If you stand in water that's up to your waist, you're doing about 50% of the work, and then the water helps hold that other part of your body upright. If you stand up to your chest, you're in about 75% of the body is submerged. The water is supporting that and giving improvement in balance. So that's a really nice thing for children who have the ability to walk but always need support. Once they're in the water, they tend to be able to do even better. Let me see here. Things to always be careful about is certainly a tracheostomy, seizures, any infections. You're not going to take a child in with those things. But you can bring a child in who has a G-tube or even has some respiratory complications. Certainly anybody that has some behavior issues or hypersensitivity, we're careful with around water, but that's not a contraindication. You can still go in the water. So as we look at the properties of water, we have buoyancy. That's what makes you float. It raises you up. And we have gravity that's pushing you down. And so when you're floating, you're in that absolutely balanced point between gravity and the buoyancy of the water. So when we use the pool for a tool, the longer and flatter you are, the more you will float. But the more curled up and flexed you are, the more you're going to sink. So we want to encourage, when we're working on flotation and getting a child to relax in the water, we're actually working on all these extension patterns, all these positions that might be hard for some children to be able to get. We will use the property of the water of turbulence and resistance, so that when you go through the water, you can change how much the child has to work. When you go faster, there's more resistance and more work that has to be done. When you go slower, you have less resistance and you can relax more. And certainly the larger the body is, if you were to swing your arm out to the side against the water, you're going to have more resistance versus just splashing your hand. So we'll use all those different properties to help get whatever we need specifically for each child. I'm going to talk a little bit about basic water safety, but I'm also going to relate it to how important that is for speech and language. Breath control is everything. Every child, when you enter the water, has to learn that if you suck in the water, you're going to choke and cough. It's not a bad thing. It's just an experience they have to have. So if the first time you bring your baby in the water and they put their face down and suck it in and start coughing, don't be nervous. Don't be excited. Just hold them upright. Okay. If you think about basic safety, when you do, if you've ever taken a CPR class, they tell you about the open airway, and that's with the head back. So that's the position you're going to be the most careful in, because you know that airway is more open. If you want to protect the airway, you're going to tuck the chin. So if a child coughs and takes in water, just sit them upright on your knee and tuck their chin and let them cough, and they will get out whatever's in there. If you had any concerns, just watch them for a little while. If your child gets nebulizer treatments, you can always do a treatment when you get home. That helps to just clear anything that might residually be inside the lungs. But in general, most of the time, it only just gets to the top. Now, a deep submerging, those are things you got to be very careful with. So what we do not do, and what you may have seen with infant classes, is the forced submerging. We don't do that. That's not part of therapy. That is an important safety skill for infant swim lessons, but we're not going to do that. So there's never going to be that forced submerging. But we will work strongly on breath control, because that's where they're going to remain safe in the water. So initially, we'll just sit on the edge of the step. We're going to play. We're going to kick. We might go to blowing bubbles if the child is able to. And how we do that is modeling. I will bring a child face to face with me, and I'll blow my own bubbles by tucking my chin. And then I'll make sure that he's up enough that when he is going to blow bubbles, he has to tuck his chin. If I put the child on his tummy and I'm trying to get him to close his lips, it's harder. So I want to make sure it's as easy as possible, because when you tuck your chin, your mouth tends to close. So we're going to sit to practice blowing bubbles with the head above the water, and the child is in control of bending down, blowing bubbles, and lifting up. What happens then? You have to close your lips, right? You have to gain some lip closure. So some children who tend to have a lot of tightness around their muscles, we might have to help them. We might actually help facilitate their lips to stay closed so that they can create that blowing. After that, we'll do some fun things where we might, if we've sat on the step and the child seems ready, we might go into a back float. And I'm going to look for that page. Let's see where it is. Yeah, that's it. Yep. So here's showing the progression. You can see the blowing bubbles face to face. We might also put our hand on the child's mouth and to give some tactile cues, close their lips and blow. And I might put the child's hand on my lips to feel the vibration and the blowing. So we're just modeling. We're really trying to get them to do it themselves, but by showing them. So now if you look at this back float, what we do is we put the child's head on our shoulders. And when you have the child's head on your shoulder, you can control how far down you go into the water. One of the trickiest parts is getting your ears wet. Everybody has a little trouble with that. If you've ever washed your baby's hair, that's probably the place they don't want to be. So we're not going to worry about that right away. But we are going to use that buoyancy of the water to help the child learn to get extended in the water. And the way we do that is by walking backwards. So I will put the child with their head on my shoulder, put one hand under their bottom, maybe one on their tummy, and start walking backwards. And the faster I walk backward, the more their body's going to be buoyed up just by the wake, just by pulling them along. If I stop, I'm going to see their legs fall down underwater because they're very heavy. The chest has the air in it, so that tends to remain floating. And then the bottom picture shows how I would go to the prone position on their tummy. This will be my last position. And this is the position I'm very careful with because of that open airway. So as you look at this child on his tummy kicking and swimming, I can use my whole body to lift them up and keep their head above water if they're going to take in water. So we're going to look at all those factors when we get the child in the water. But what do we have here? Face-to-face interaction, lots of language opportunities, great sensory input where the child is feeling the wonderful massaging, relaxing flow of the water across their body. And that flow is really just what I'm saying. It's like a full body massage. The more they become active, the more strength that we're building, and the endurance and the cardiovascular benefits. So those are there. Let's go back. Make sure I cover all my bases here. There was one more. I'm sorry, I'm finding it. I was going to do a PowerPoint, but no way, I'm not ready. There's another one. Where is it? So the other one thing that I'm going to tell you as a parent that's really wonderful, if you're a mom who is either pregnant or has had a baby and you have any issues with swelling in your feet, get in the water. The water pressure increases the deeper you go. So it's just like a nice compression stocking. The deeper your feet are, the more it's pumping fluid out. So any child with swelling, any person with swelling, just being in the water helps to get excess fluid out. It will require more kidney function. So children who might have any issues medically with their kidneys or heart, that's something to be careful about. But in general, it's a really, really good opportunity to make your legs feel happy. And I can tell you that. So here's some different exercises, how we might use the water for me, particularly for physical therapy. And I put in lots of names of different muscles, but I can use the water to help muscles that are weak just by letting the buoyancy push up the limbs. So if I have a child that has a hard time lifting up their arms or lifting up their legs, and I put them vertical in the water's going to help them do that motion. And I can do it on their tummy or on their back. I can do things where they're supported in the water and just moving on the same plane. So again, a child with shoulder weakness who can't lift their arm this way out of the water, I can put them in the water, and then I can get some of that nice muscle action. And if they can't do it themselves, I can put a flotation support in their hands and move them out. I can also put a flotation support under their arms. And that could be just as simple as pool noodles. They make little dumbbells, little barbells that float. All those things are really, really helpful. So I can get all these motions. I can do it on their back and get their legs to open and close and their arms to open and close. And I can use that to get their body to twist. So if I'm sitting them up and I just swing them around to the side, the faster I go, the more they're going to have to pull their legs back to keep that midline orientation with their body. So I might use that slowly to get the body to relax. And then I might go fast to get them to tighten up their core and be stronger. And if I incorporate any kind of vocalization with that, then I'm getting all the extra benefits for kids who don't talk easily or have difficulty with getting a vocalization out. So, and then when I do buoyancy resisted, that's where you push down against the resistance of the water. And that's a super strengthening activity. So there's tons and tons of things that we'll do with that. And then I can begin to work on those transitions, like how do I get into an upright position from a floating position, and learning to bend your knees up to make yourself into a little ball and then straighten your legs down to the water. So there's kind of a progression that we'll do when we get in the water. Rhythmic breathing, being able to breathe out and bubbles go into the water, come up and get more air, and doing that repeatedly so that they know when their lips hit the water, they've got to close them and blow out. So I don't do it forcefully. I will ask them to do like 10 bubbles. Okay, you got to make me 10 bubbles. Okay, you ready? And you got to count. 1, everybody does 1, 2, and then they have to lift. And when they lift, that's when they count. So that's where we get the vocalization to come in and a breath come in. So we'll do those. We'll go into the back float. And again, being cognizant that they may not like their ears in the water, but a lot of times once they do get their ears in the water, the kids love it because it's quiet. And especially in a loud pool where there's echoes and different sounds that can be a little bit annoying to kids, don't be afraid to get their ears in the water. Just realize that they're going to have that moment of, I don't know what this is, and I don't know if I like it, but once they get in, they usually love it. What I've seen is a lot of children with, they're on the autism spectrum, their favorite place to be is under the water. They love to dive for things. They love to swim underwater. And I think it's that full deep pressure on the body, that nice relaxation, the quiet environment. So they just get a really good release of all those good neurochemicals that calm them down, not to mention the benefit of all that exercise. So when you finish a session, they get out, they're just as calm as a little jellyfish. Not always, but that's the goal. So yeah, we'll do that back float and recovery, and I'll give them the verbal cues, and I might show them, tuck your chin, bring your knees up, put your feet on the floor. Same with on their tummy. When they're down and they can put their face in the water and you're ready to teach them to come up, you might say, bring your knees up to your chest, look up and put your feet on the floor. And so kind of we have to know these sequences, and that's how the body will move in the water. But you can, if you do it yourself and pay attention to what you're doing, you can cue your child and ask them to do the same things. Turning over, that's another really big one. I might not turn a child over for a long time. Once I'm ready to, once they're able to put their face in the water, we give a lot of counting, a lot of prep so that they don't feel like we're just going to dunk them. But you can help them by just bringing an arm across the body, and then the body will just complete the role. Any child that has a muscle weakness that's more pronounced on one side, it's really wonderful to get in the water because the water doesn't lie. If you hold one arm out, but this one's flexed, your body's going to tilt that way. So it's a really great encourager without saying one word for that child to stretch out the other arm, to be able to get a more equal balance in the water. One of the most important positions that I like eventually is that long arm Superman position on their tummy. If I need to, I'll put pool noodles under their shoulders, like across their chest so that they're over it, or under their hips. If I can give them a pool noodle or a barbell to hold on to, I'll give them a big ride. I'll let them feel the water pull their body straight so that they understand what that position feels like and how supported they feel in it, versus a child who's afraid or who has a lot of flexor tone and curls up. They feel like they're always sinking. So a lot of it is just an experience. They have to feel that movement and feel that nice full body straightening. And then they try to reproduce it without you even saying a word. I'm wondering if there's any questions. I'm kind of talking a lot. Let's see, where would I see them? Sure. It doesn't matter, no. Yes, good question. So you may see that your child will have a bowel movement either during or after, and that is just in general, it's be prepared, okay? So we don't allow, and you shouldn't allow regular diapers in the water because those little gel beads just into the big explosion and it's a mess in your pool. But you have swimmy diapers, and you can put a cover on over it. So don't be surprised, don't be put off by that. Understand that their GI system is actually getting a good workout too. So that might be something to expect. And if you know when your kid goes to the bathroom, then you might want to time it after that, and if you've got a pool at home. Andrew says you're amazing. Right. So if you feel like your child would benefit from this, what we'll ask you to do is call our office. They'll give you the information. There's a link that you're going to fill out. I think it's a Google form or something, or they'll fill out for you. And then we will, if you're already a client of progressive pediatric therapy and you get OT, PT, or speech, we can just incorporate it into your regular plan of care. We just need to make sure that you understand that we're doing this. We do have an administrative fee just because there's a lot of planning that has to go into coordinating schedules, getting families signed up, making sure that, we have all the things in place. I do want to mention that Hope for Mobility has supported, Hope for Mobility is a local nonprofit in Palm Beach County that helps with equipment and services for children and families with a child with special needs. But they have supported our aquatic program for many years. And, we are renting a space. We swim at the Small Fish, Big Fish swim school. And Melissa Taylor, who owns that pool, has coordinated and collaborated with us from the beginning. And she's wonderful. And she actually does the drowning prevention classes and has swimming classes throughout the week. We just use the pool on Friday afternoons. But it's a heated indoor pool. It's shallow enough that every adult can walk in there. There are submerged tables that a small child could stand up and walk on, tons and tons of flotation devices and equipment. So it's really it's just a wonderful place to be able to go and do aquatic therapy. So that's where we hold the classes, and I do want to thank Hope for Mobility for always supporting this. It's one of the best mediums for doing some really nice therapy. And it's rare that we have a child that we can't get in the water and do the aquatic therapy. But any safety risk, safety is always primary. So if a child is really aggressive or too much of a flight risk or a runner, we don't feel safe, that would be one concern. A tracheostomy is another big concern. But in general, I would say probably 99% of our kids do well in the water once we get them adapted. So that would be the process, just calling our progressive pediatric therapy office and beginning that sign up. Okay. I asked Mary about 20 minutes before 12 o'clock if she could do this today because Miss Lisa was not able to. So she was not prepared, but she sounded very prepared. So thank you, Mary, for kind of jumping in. It's kind of a passion of mine. So anytime I can get a kid in the water, that's where I'm at. So, and hopefully Miss Lisa is going to feel better, and she'll be here next week. Yes, hopefully. She showed me that she's okay, but she's just not able to do this today. Okay. All right. So I guess no more at this time. Anything else you want to add? No, I hope you guys can join us, whoever. Thank you. Right. Well, thank you, everybody. And if you have any questions, please comment, and we will certainly get to your questions later on and make sure you get all the information that you need. Thank you. All right. Thanks, everyone. Bye. Bye.